The incident that brought this top of mind for me was a trip to the grocery store some time ago where I saw a young family that had two shopping carts, one filled with groceries and one completely filled with bottled water. It occurred to us after seeing that over and over again that there's potentially a confidence issue with the tap water in Des Moines. So we reached out to researchers at the University of Iowa to see if there was anything we could do to rebuild that confidence, and that was the birth of this project.
So we know that tap water is fairly stringently regulated by the US EPA under the Safe Drinking Water Act. It's completely different for things like bottled water and kiosk water. Bottled water is actually regulated by the Food and Drug Administration as a food product, and there aren't particular standards or nearly as many that are set for the quality of that water. We don't really know much about how kiosk water is regulated, if at all. We don't know that there's the routine monitoring that's expected of tap water.
We do extensive testing every day on the finished product here at Des Moines Water Works. Not only do we test throughout the process, but we test at the end of the process to make sure that the water we're delivering to our customers is safe and clean.
What we see is that nationwide, a lot of people drink bottled water even when they have safe tap water to drink. And this leads to equity problems because what we see is the folks that spend the most on bottled water tend to have the fewest resources.
One of the reasons I care about this issue is we see across Iowa, it's often our low income and most vulnerable Iowans that are purchasing bottled water and kiosk water using a large portion of their income when they have a cheaper, more regulated supply at their taps.
And so we're trying to investigate the sources of this distrust and design what we call interventions in order to help rebuild confidence in this important basic service. In phase one, we took a qualitative and quantitative approach to understand people's perceptions of tap water and also their drinking water behavior. We conducted focus group interviews, and we collected the locations of kiosks throughout Iowa in order to do some demographic analyses.
There are also implications beyond just access to tap water. If we think about people who are less willing to trust their tap water, they might be more inclined to purchase things like soda pop or other types of sugary drinks that might be less healthy for them than tap water.
So I was shopping in a discount store and I saw a huge ad by a bottled water company with a huge picture of rusty pipes. And it seemed like it was very intentional in attacking confidence in tap water. It was infuriating because at Des Moines Water Works, we spend our whole careers trying to produce safe, clean drinking water for our customers.
What's really great about this work is it's entirely driven by the community and our community partners. There's real, meaningful, high-quality research that can be done in this space, but the problem was brought to us by the Des Moines Water Works out of concern for their citizens and trying to figure out the best way to get them more access to the high-quality product they deliver.
This project is important not just to Des Moines Water Works, but to the tap water industry nationally, because we're seeing this trend across the country where quality of tap water is not declining, but the trust in tap water is declining, and that's what we need to address.
In phase one, we heard concerns about tap water excellence, openness, and equity. And so in phase two, we plan to dig into these ideas in Iowa, Wisconsin, and Missouri in order to see how changing some of these things changes people's perceptions of tap water.
So the activities we have planned for phase two are really exciting. There's a real focus on increasing excellence, equity, and openness around tap water from the Des Moines Water Works. We have targeted marketing efforts and outreach efforts to communities that have lost their trust in tap water. We've intentionally designed our efforts in phase two to think about how lessons learned in Des Moines can easily transfer to other communities.
Phase two represents an opportunity to put into practice what we heard from residents of Des Moines. Concerns about taste, concerns about cleanliness, concerns about hearing from their utility. These are all things that we can change in phase two to see if there's any effect on people's confidence, not only in tap water, but in government itself.
We're excited about the future of this project because we hope to be implementing these strategies that we learn about, and they're going to be replicable across the whole country. So this research and this pilot project are so valuable.
We are really in the public health business. Delivering safe, clean drinking water is foundational to having the cities, the communities that we have.
We have a trusted long-term relationship with the researchers at the University of Iowa. We're very excited to continue this partnership in the next phase.